country where COVID, there's no research going on COVID. There's no possibility of vaccines. There's only probably about, at that time, there was only about 200, less than 200 ventilators in the whole country. So I thought I would share with you just what that year was like for us, because most of you have heard me talk, you know what we do. So again, I just wanted to share that with you, and we'll just go to town here. So these were our goals by that, of course, like everyone, all fell apart by February of 2020. And we always have quite a few goals every year to try to meet. And we're a small organization, but we get a lot done in one year. And of course, Gig Harbor Rotary Midday is like one of our most astounding supporters. And there's a couple of Rotary grants in there that you're looking at that are projects that are funded by Rotary. And you guys are always on our Rotary International grants. I think we have 3 grants right now in process in some form, either in their first year and their second year, or just beginning, or in process of being written. So I'm not going to read all that to you. You're welcome to read that, and you can ask questions if you have any questions later about just how some particular project might work. But those were the projects that were scheduled for 2020. By March 10th, approximately the same time things started closing in Washington State, the whole of Bolivia just shut down. Like I said, there's very limited medical care, very few hospitals, and very few ventilators. So everything shut down, and that's the street right outside one of our offices. And you can see it's cleared. Nobody's allowed out on the street. And quarantine there existed as it was militarily enforced. People were allowed to leave their house usually once a week. And your ID card, the last 3 digits, based on the last 3 digits or the last 2 digits of your ID card, was when you got to go outside your home. And every family member had a different day, usually, depending on, and no 2 family members could go out at the same time. So all schools shut down completely, not any online schools for most people. Because kids just don't have computers and things like that. So none of that happened. It was, I was trying to think. So, and cars were limited. You couldn't drive. Like all of our cars in Montero could not be even removed from the driveway. So in the city, you couldn't take the cars out. You weren't allowed to. And in the rural areas, we were only allowed out once every week. And in that case, you had to get a voucher from the mayor to even fill your car up with gas, which was a problem for us because even though we could only go out once a week, we still needed gas for our vehicle. And so trying to get a voucher, and you had to get it from the government, it was not easy to get. We were successful at one time and finally got 1 full gas tank full, and that kept us through several months, going back and forth as long as we were careful. The only thing open, like in the US, were grocery stores and pharmacies. Nothing else was allowed to be open. Our offices had to be shuttered and closed, and nobody could come or go at all. And you can see here, and you've probably seen it on TV in other countries, they're spraying down streets with bleach. It's not thought to do any good, but it seemed to make people feel better. If you went out into the mercados, because grocery stores are only in the city, so you still had to go to open air grocery stores in the rural areas. And if you went out into the streets, the military would come out and spray you down with bleach. And they said it was a combination of bleach and disinfectant. Nobody quite knew what was in those packs. But anyway, it wasn't a pleasant experience. so it was difficult for many people. And then if you're in rural areas, because there's no transportation, people couldn't get to food. They couldn't get to clinics. If you couldn't walk there, you just couldn't get there. And we would have to drive from we have a rural office, and we'd drive from our rural office to the closest street in town, park the truck there and get out and have to walk into town and funnel all groceries back and forth to the truck, because we weren't supposed to be out in the truck. But we couldn't walk the 10, 15 miles to our rural office. So anyway, all of our projects obviously came to a complete halt, and then healthcare systems began to fail in Bolivia. Montero, where we have our main office, was the epicenter for it would be equivalent to how things happened in New York. It was the worst hit. People died at an amazing rate there for a little while. And I have to say that we experienced a lot of COVID in our own organization. We had 2 former employees die of COVID. One was older, but one was only 40. And I can share with you that it was dramatic. He called us because he's a nurse, and he couldn't get oxygen, couldn't get into a hospital. There was no hospital care available. He called us to try to help him get oxygen because he couldn't afford it. We finally got him oxygen, but unfortunately he died the next day. So it just wasn't quick enough. And then other people that we just know began to die. So it's been a very hard time there for my staff. As hospitals filled, what would happen is all the medical staff from the rural areas would have to be brought into the cities to take care of people in the hospitals. And that left this huge void in rural areas. And so by June, we were given special permission to go out into the rural areas and to deliver training to rural people, but also mainly to our health promoters that we had already trained. We have over close to 200 health promoters out in the world and in many, many different communities. So we were allowed to go out to those communities, deliver PPE, check the clinics to see if they had medications, and we were allowed to bring them PPE and medications. Under the Rotary grant, we just shifted some money around and bought a lot of PPE and then distributed it to clinics and health promoters. And then we were allowed to train them on COVID response as best we could. That's our doctor there in the photos you see with the blue hazmat suit, or the pink hazmat suit and the white hazmat suit. That's our doctor on staff. Everyone in all except the bleacher pictures, those are all health promoters that are trying to learn about COVID and how to respond to their communities, because all the doctors are gone, all the nurses are gone out of the communities at the closest clinics. So the health promoters become the primary healthcare providers. And but we needed to catch them up on what this was. Also in Bolivia during that time, there was elections going on like in our country, and there was a lot of myths, lots of one political party saying the COVID is an untruth and none of it really exists, and it's just a fake news from the other party trying to scare people. So it just was very, very similar to what was going on here in the States, and still is. So the health promoters that we've worked with and that have been funded under some Rotary grants became the real first line for rural folks and the sources of accurate information. So again, you may remember from my talks in the past, we train health promoters and then we help them teach and train other people. We were able to get them some oximeters. You can see the gentleman there in the middle using an oximeter, and those were very helpful during this time, just measuring the level of oxygen people were receiving and so forth. But you can also see in the left hand there that they're training. And you can see in the right picture, that's Dr. Caterini again. She's our doctor. She's always there to support the health promoters, answer their questions. She's on WhatsApp. They are all on a WhatsApp line. And if they have questions, they can ask her in the middle of the night and she'll answer them. Then what we realized was the medicines were running out. There was very few medicines in any of the clinics. An ibuprofen could cost up to $20. So it was not available. So we beefed up and brought in our medicinal plant doctor who trains with us usually, but then brought in, and we began training health promoters. We held other new sessions where we trained them more intensely in health promotion, but we also went into communities where, see the second photo there, the first and second photos, very remote rural communities where we were able to go in and just teach people what to do. If you can't breathe, which herbs to pick, how to do, you can see her head, both those shots, you can see heads covered, how to use steam to clear phlegm, and just to try to help people survive this. Then we were fortunate to be contacted by Bridge of Life, who is a partner with DaVita, their nonprofit side. They usually go out and work with chronically ill, kidney disease, and so forth. But we know them and have worked with them for many years. But they called us and said, can you go, we'll provide you the money if you'll go do the training. And so we were given permission to go again and start training for high-risk patients in kidney disease. And again, all of those people that you see in the blue there, that's just one cohort that we trained. We trained 3 other cohorts besides them. And they would work with the high-risk patients to try to prevent COVID, but it's not always possible. But you can see that we were able to step in for another NGO because we are on the ground. We do have staff there and do some of their work for them. We also began to think about how to improve hygiene. This was early on. And so we worked actually with some folks here in the US and created a contactless hand washing station that can be managed by anybody. And then we distributed these to health clinics in public places in rural communities. You can even see up in the right-hand corner in the woman there, they had their elections during this time. Our health promoters who were in charge of them brought them to the election polls so that it's mandatory that you vote in Bolivia. And so everyone had to come in and vote, but they had hand washing stations there for them to wash their hands with. And we were pretty proud of that contactless hand washing station. So we distributed about 120 of those. And as I told you, there were no schools. And schools don't have teachers who can work remotely, nor do they have students who can log in. This is a small community called Isama. And we were able to, because the teacher lives in the community, not in most rural communities, the teachers come in from the outside. But in this particular rural community, the teacher lives there, and we were able to offer them age-appropriate packets to be able to continue to teach their children. We also did that in other communities when we knew that there was a teacher or an adult who would monitor and supervise the children doing the work. So we were able, they weren't cheap to print, but so we were very particular about who we allowed them to have them. But we were able to produce probably around 300, 400 of those at different age brackets, depending on what they needed. They would place the order and we would go print and get them to them. So we were able to resume work in July. Things had calmed down. Things didn't open up completely, but they did calm down. So these were our final accomplishments. Instead of 2 water systems, we got 1. We did complete 1. They just got running water last week. It was actually, it was the 29th. The goal was before the end of the year, and we made it barely. And then we did complete the 2 health promoter programs, and that was a Rotary Global grant that you guys participated in. We taught 30 women medicinal plant course, distributed the PPE that we talked about. We only completed 53 ecological composting latrines out of the 120 we should have built. but we did okay. And so those, as well as the hand washing stations and the consultation. So those are the things we actually got done, and we're pleased to just get that much done. And it was a tough year for everyone, for lots and lots of reasons. But I just thought it might be nice for you to see and share. You know, you've supported us since we began, since 2003. And so you can see what we're still doing or trying to do, even under incredibly difficult circumstances.
Pennye, really great. Yeah, thank you so much. I mean, it looks wonderful that you did all of it, what you could do. And yeah, we really appreciate your sticking it out and doing whatever is needed for those people in Bolivia.
Yeah, we have a global grant in right now with you folks for a whole new cohort, 2 new cohorts of health promoters in some remote rural villages that we're hoping to get approved. We're on the waiting list for approval, and I think I told Llewellyn the other day, we're just holding on to hold on to your check. Hopefully we'll get approval soon. They've told us we're in line. We just haven't gotten up to the top yet. We're swimming to the top. So I don't know if anyone has any questions.
Yeah, this isn't a question, Pennye, but what you just gave us would make a fantastic article for the 5020 newsletter. Would you please send me your PowerPoint briefing and then synopsize what you said as thoroughly or as unthoroughly as you like, and I'll warp it all into an article.
Okay, I can do that, Don.
That would be wonderful. Thank you.
And by the way, this is the first time I recorded it, hopefully short enough so we can post it on our site.
Oh, see, Don, see, you have that. You have a recording of it.
Yeah.
Well, Gunda has it. I'm not going to take it for granted. I can see it.
The thing is, the problem we had last time, I was trying to put something out, but the recording was too long, and YouTube said, no, can't do this. You're running out of space. So I'm learning to cut it down to the bare essentials. Yeah, but I'll try it again. Yeah, any questions?
We'll bypass the recording, Pennye, if you'll just send me a little bit of
I'll send it to you.
Thank you.
Do we have any questions for Pennye?
Yes, I do have a question.
Go ahead.
Okay, Dave, shoot.
Okay. And that is with those children, when they're not in class or they're not getting online education, Pennye, then if they were in the 2nd grade at the beginning of it, a year later, would they still be in the 2nd grade?
It's funny because Bolivia has determined right now to pass them along to the next grade, although they've had no education. So, you know, I have no idea what's going to happen. And we don't even know if they're going to open in February. There's no notification that the schools will reopen in February because the 2nd round of COVID is now coming through and things are shutting down again. So I don't know. Their school goes from February to December. So school hasn't opened yet for this year. We'll see if it does. But no, they determined to pass them all along. Because some of the kids in the cities did have classes online, but those were obviously the wealthy children, the children who had access to it. It was not the children we work with.
Yeah.
I have a question, Pennye.
Okay.
Maybe I missed this at the beginning, but is there any opportunity for anybody to be vaccinated, healthcare? In Bolivia?
In Bolivia right now, they have been given Russia. They work with Russia, and Russia has provided a vaccine. Now, as far as we know, there's no testing on this vaccine, and so that vaccine is said to be available. And I wouldn't take it if I were them, but I don't know what's going to happen. But right now, there's no vaccine available, other than the Russian vaccine.
Pennye, I have a question. So you may have missed this at the beginning, but how about your staff? Are you comfortable leaving them there? Has anybody gotten sick?
Our staff is Bolivian, and we only have 2 people on staff who aren't Bolivian. and they live there permanently too. So,
Okay.
uh,
So that wasn't an
we
issue.
don't have, when COVID started and when the country shut down, we did have multiple people on the ground. We had 4 Italians, 2 Swedish people. We had an Argentinian person on the ground as volunteers, and they were stuck in Bolivia. So the Italian consulate sent over a plane to evacuate the Italians. So they eventually got home. And then the Argentinian could not get home and ended up with us for months before the country opened up again. And the Swedish people ended up with us for several months before they could leave. But my staff, actual staff, live there and are Bolivian for the most part.
And have they all been able to stay healthy?
No. In our staff, we've had 3 diagnoses of COVID, 1 critical, and like I said, our former staff member who died, and then another former staff member. So actually, we've had probably, of the 15 people, 4 have had COVID.
Wow.
And the others may have had it, but there's no testing going on either. But nobody had it that couldn't. And we paid for all of our staff to be tested if they wanted to be tested. You can't get free testing; you have to pay for that. So we've paid whenever they wanted testing, and we've paid for their health care that they've gotten after testing too, for those who were sick.
Hey, Pennye, you mentioned medicinal plants, and are they finding they're effective in treating people or not?
They're effective in treating symptoms. They're generally the same medicinal plants that we always teach. We teach medicinal plant program anyway. We just beefed up the respiratory elements of it all and we taught not just the health promoters, but we actually taught in communities, because sometimes health promoters aren't even available. And so people need to be able to know how to make just poultices and respiratory relief. So it's only symptom relief, headache relief, it's teas, it's very basic kinds of things that are helpful. And the good thing about the health promoters is they follow up. So they'll go back to the house each day and check on people to see if they're getting worse or getting better. Whereas even, it's better than actual clinic care, because clinics won't do that. So it was really important to just have the follow-up that the health promoters. So we created a whole curriculum for them to follow up with every patient that was lived in their community.
Okay, any other questions? Pennye, thanks a lot. Really wonderful
Thank
to hear
you.
you.
Thanks for
Every
having
single
us.
time you come in, it's just very enlightening, very wonderful. Great
Thank you.
presentation, great stuff you're doing. Yeah, good luck, and good luck for
Oh, and
2020.
as soon as you get your vaccine, we have it completely given up a 2021 trip for volunteers in September, but it's slim. It's like this big.
Slim, yeah, very slim.
But we'd love to have somebody go with us.
Okay, let us know. I'm quite sure we'll find some people who would love to come along. Perfect.
I
Thank you.
will make sure that as soon as I hear from you that the grant was approved, I'll make sure that the check is sent out.
Thank you. Thank you.
Good. All right, guys, you're almost there. Share screen again. Portion of the screen. God, we're getting so good at it, right? Here we go. Happy Bucks. Lorna, are we ready for Happy Bucks?
No, yes, I'm kidding. Yes, we're ready. Sorry. If you have a Happy Buck, we're doing $5 for the Bishop Food Bank.
We're not doing 10?
I'll start by saying $5. I'm so happy Pennye could Zoom with us. Pennye, it's so enlightening. We always feel so good about ourselves and inspired by you.
Thank
I
you.
wish
Lana.
we could do more. Thank you very much.
I've
Let's
got
go with
10, I've
Dawn.
got 5 for Penny and 5 because I finished a workshop project this week.
Very good. How about Tamis?
You're mute, Tamis, you're mute. Tamis, you're mute.
I'm always grateful to have any time with Penny. She inspires me. She inspires our Rotary. Thank you, thank you. Whoa. And then I'm grateful to our Rotary Club. I'm grateful to you, Gunda and Lana, for, I was really proud of what we've accomplished the first 6 months of this tenure. So thank you. And I love our social half hour before. It's a chance to have some real connection. So especially during these times where we really have to be careful while we await the vaccine, just really appreciate that. So I'd like to give $10 to the food bank.
Thank you, Tamis.
Lana,
Uh-huh.
I'd like to give $10, and the $10 because I know we all in this Rotary Club feel grateful for each other in this time, because we have been able to stay connected, and that's a really important thing. And to you, Penny, you're just an amazing woman. You give us so much inspiration and admiration for everything you're doing. So keep up the good work.
Thank you, Carol.
I'll give $10 too. And again, I congratulate Penny for the incredible work she's doing. And I think that it's important that we support the food bank in our local area as well.
And I give $10, and Penny, thanks for your wonderful presentation.
You're welcome.
I also will give $10, and thank you, Penny. It was an excellent presentation, very informative, and
Thank
so
you,
stay
Marilyn.
safe and be well.
Yeah, I'll give $10 too there, Lana.
Oh, hello there.
And
Hello, Minnesota.
there. Yeah, Penny, it's incredible what you're doing, and I hope you've been able to do more next year. And I'm also happy and grateful that even though I'm like 1,700 miles away, I can still be a member. And
we love you here. Yeah, perfect.
And so that's also, so $10 from this side from the Midwest.
Thank you, Paul.
You're welcome.
I'm in for 10, Lana.
Okay, Rick, do you have anything to be happy about, Rick?
Well, I'm certainly always happy to see Penny and hear about the great work she's doing in Bolivia, particularly during this time, the COVID, which is, we think we have it rough here. It sounds like it's doubly difficult to manage in Bolivia. Beyond that, it's
I
raining.
can come over and spray you down with bleach if you want, Rick.
That'd be good. Beyond that, it's still raining, so.
Yeah, it's still raining.
Yeah.
I'll donate 10. I thought that was a great presentation, Penny, and it's nice to know that other people are going through a lot worse than we are, probably.
Yeah. Anybody else?
Yes, of course. I'm good for 10. And I also want to tell everyone that I was at Bischoff last week. They have moved. They're back in business.
Wow.
They're serving the people. A little smaller facility. And our refrigerators and freezer are right there as you walk in. So they made the move with those, and they're back up and running.
Right.
Hey, Dan, where did they end up? Where are they?
They're right at the corner of at 134th on 134th, just past the stoplight going to Shelton at 134th, right on the main Keep Peninsula Highway there.
In that little white building that kind of sits up on a little hill?
That's right.
Oh, good location.
Thank you very much, Penny, and I'm also in for 10.
Thank you.
I'm also in for.
Who is that?
$10.
That was Edison.
Addison.
I'm in for $10. Remember, there's only one penny, but I'm in.
Dave.
Yeah, I missed before Dave. Who was that?
Edison Richard, our visitor.
Okay.
Me down.
Thank
for
you,
10.
Edison.
Denny's in for $10 just because I like Penny.
I see Scott, I see Mary and Julie raising.
Yeah, and I was thinking that Penny, took a terrible situation and really made something beautiful out of it. And I feel like that's what this whole year has been. So.
Good point. How about you, Julie?
I'm in for 10 and in support of our local store owners. Today I visited the Madrona Cafe in Key Center. I highly recommend it. Go visit them.
Okay.
Who are they, Julie? I didn't get that.
The Madrona Cafe in Key Center just opened.
Oh, okay.
Oh, great.
Have I missed anyone? Oh, Sherry.
Yeah.
$10 for me. And Penny, thank you for the great presentation. Really well done. And I was, as you were talking, Penny, I was thinking about when I first met you. I mean, you could barely talk. You could barely speak. I mean, if you remember, and it was so raw and so honest, and you are amazing. So thank you.
Okay, are we all done? Thank you, guys.
I think there was one more. Am I missing someone?
Well, did you get Dan?
Dan
I got
Brown?
Dan Wilson.
Yeah. Did you get Dan? He tried to get in there a few times, as did I. Everybody's so quick.
Scott.
Johnny
Scott
on.
and Dan.
Yeah, I'm happy. I had a very COVID birthday for my youngest twins. They turned 15 yesterday. And so we had a very COVID birthday.
Happy birthday to the boys. Okay, Dan Brown, are you around?
Yes, thank you. Thank you, Penny, for all that you do. You're just someone that we can all look up to. Thank you for everything.
So I'm going to close the happy bucks. It's nice to share the happiness, and these dollars are mounting up. We're going to look forward to seeing how much we've given over the last 6 months. But good job. Good on you all. Thank you very much.
Thank you, Lorna. Hey guys, do we have time for fun or should we skip it? How are you doing, you guys? Scott?
I have nothing.
Okay.
Sorry.
Scott?
Looks like a good skip time.
I haven't been traveling.
I have not
Skip
prepared
time?
anything. I'm sorry.
Okay. Next meeting, January 12th, we hear from Jack White, Long Live the Kings. And we'll have classification talk from Amy Gordon. Okay, and then the next thing is, of course, my German stuff. Did you know that the Germans are the second largest beer consumers in the world after the Irish? You probably didn't know that, right?
I thought you were first.
Yeah, I did too.
Aren't there more Irish than Germans, or is it the other way around?
There are more Germans than Irish.
What does that say?
Yeah. We also have over 300 kinds of breads.
Wow.
I know that.
Here did I.
And then Munich is further north than any major city in the US, excluding Alaska. You didn't know that either.
No.
No.
And then, of course, you know that 65% of the Autobahn has no speed limit.
I thought all of it had no speed limit.
No.
Yeah, I thought the same.
No. Sometimes there's so much construction going on, you are living in a construction zone. It took the Cologne Cathedral 632 years to build. It can hold 40,000 people. You can understand why it took 700 years. And that is what German workers. In Britain, they would be still digging the foundations.
They'd be waiting for the permits.
And here's the longest word published in the German language. Donaudampfschifffahrtselektrizitätshauptbetrieb für Baugesellschaft. It means this means union. This means company. This means electricity. This means ship, a steamship. And this is Danube. So which means it's a union for the workers in the Danube Steamship Electricity Company.
Good gravy.
Wow.
Easy for you to say.
Yeah.
But I could tell you anything what it means, right?
Yeah, you could.
We're not going to ask you, Gunda, how come they don't say it in 6 or 8 words like everybody else would?
We don't, because we are Germans.
Yeah.
I mean,
Language.
it all
That-
belongs
that-
together. I mean, how can you make fun of it? No. So we have over 150 castles in Germany. How many do you have? We have
Yeah,
60.
Trump Tower.
We have the
We
Trump
have more
Tower.
beer gardens.
And
Hey, there's the
interestingly, we have
There's
over
the Trump Tower.
400 zoos, which is the most in the world. There's a lot of zoos out there.
Wow.
And of course, this is my favorite one, the 1,000 kinds of sausages. And then remember this, most taxis in Germany are Mercedeses. It's not like little clunkers here. We have good cars.
What about Volkswagen? Volkswagen.
No, there are taxis in Mexico.
Oh.
That's
Have
funny.
you ever been to Mexico? You've seen those green little beetles running around as taxis. Yeah. So that's the end of my German instruction for you guys. So I will quiz you next time and ask if you remember some of those.
Don't ask us about number 6.
I will ask you to pronounce it. Okay. Good, you guys. See you next week. Great seeing everybody. And don't forget to log into Dan's meeting at 1:30, which is at the
Thank you.
beginning of my email I sent out yesterday. Oh, I'm sorry to say, yeah, I forgot to mention about Joe Flack. You got my note that Joe
Yeah.
Flack resigned. So very sorry to see him leave. But, you know, with him living in DC and with his new responsibility, so it's very hard to maintain the contact. So if you want to say,
You'll have the same email address.
he has the same email address. So you can go into the inactive list and you can find his email address out there. So send him a note. Thank you guys. Have a great day.
Thank
See you
you.
later.
Thank you.
Bye.
Good.
Bye.
Penny?
Thank
Thank
you.
you.
Thank you.
Thank you, Gunda. It was a good meeting.
Thank you. So you can log on anytime, Greg. I mean, it's always the same link.
I'll be back. Okay, I copied that down. So it's going to be that link every
Yeah,
time?
every time. Yeah.
Yeah, I see that. Thank you. I'll be back.
Perfect. Good.
Thank you.
Bye, Danny.
Bye-bye.
Have a good time.
Yeah, thank you.
Bye, Dave.
Bye-bye.